All right, so I think we can get started. So basically, for those of you joining today, we're gonna have the lovely Dr. Kimberly Ford today. She's gonna kind of be introducing herself, telling us about her role, her positions, her work at GSK. So it's an amazing opportunity for all of you guys to see what she's done and for you to learn about potential future opportunities as well. So, Dr. Ford, if you'd like to introduce yourself, tell us a little bit about yourself, your experience.
Sure. So again, thank you so much for having me attend your meeting tonight. I'm Kim Ford. I'm a pharmacist by training. I reside just north of Atlanta, Georgia. So I've been in Georgia all of my life. So just to give you a little bit of history and context around me and what I do professionally, I obtained my Bachelor's of Science in Biology from Spelman College, and from there, I went on to pharmacy school at Mercer University. At the time, it was Southern School of Pharmacy, but it's now the College of Pharmacy. And I finished there back in 2005. I actually had a non-traditional path into industry. When I finished, I didn't do a residency. I went straight into the workforce and started out in the retail setting, as many pharmacists do. So I did retail pharmacy probably about 6 years or so, but I also simultaneously maintained a clinical role at a hospital. So I held a PRN position as a clinical pharmacist within the hospital space, just to keep up those clinical skills, because it is a little bit different in the hospital setting versus in retail. It's just a totally different skill set. So did that, and that actually helped afford me the opportunity to obtain various different roles outside of retail. So from my initial retail experiences, which included, at the time it was Eckerd Pharmacy, which has since been bought out, I think some of the CVSs may have taken over, and Rite Aid have taken over some of the Eckerds. But I left there, went to Publix Pharmacy, and from there I actually went into the specialty pharmacy realm, and did that for a little over 2 years. And that kind of opened the door for a broader range of opportunities. Because of the different subset of medications that I was dealing with, they were considered specialty. So those are the medications that are, one, very expensive, and they're usually for patients who have very rare diseases oftentimes. So it includes your HIV patients, oncology patients, patients with various different inflammatory conditions such as rheumatoid arthritis, all patients with MS, so various different specialty conditions. And like I said, I did that for about 2.5 years. And from there, I transitioned into managed care. And in the managed care world, I worked for Centene Health at one of their PBMs, which is a pharmacy benefits manager. So whenever you go to the pharmacy, if you get a prior authorization review or your medication is rejected, needing a PA review, I was one of the people that actually reviewed those medications. And I actually did it for specialty medications. So did that for about 2.5, 3 years. Stayed within that company and did drug utilization review as a pharmacist, which actually looked at a different side of the medication review process. And I worked with both commercial Medicaid and Medicare claims. And so from all of those experiences, I was actually able to move into Anthem, Blue Cross Blue Shield, which is one of the, I think it's one of the top 2 managed care organizations in the country, next to United Health. And in that role, I actually did specialty medication strategy. So I worked on different strategies for cost of care within the specialty space, within the pharmacy benefit, as well as the medical benefit. And I did that for about 2.5 years. And then that opened the door for a new position within Anthem, which was a field-based role, which actually I think is a role that actually opened the door for the role that I have now. But in that role, I was a provider clinical liaison for the oncology solutions team. And within that role, I actually engaged oncology providers around Anthem's Oncology Pathways program, which is basically a regimen of oncology drugs that are shown to be not only efficacious and have a low incidence of toxicity, but also kind of manages the variation in care across the oncology spectrum. So it kind of contains all of the different, it lessens that variation in treatment of care across various different cancer or tumor types. And as I mentioned, that was a field-based role, a very exciting role. And I did that for about 2 years. And then this role within GSK became open. And I've always been interested in industry, but because I didn't do that residency initially, I had to kind of chart a different course per se to get to the end goal. But I've been with GlaxoSmithKline for a little over 2 years. And then the role that I have now is what's called a oncology health outcomes liaison. And within this role, it's a field-based role as well. But I work with individuals who are considered healthcare decision makers. And those are the people who make the decisions on what medications are added to their formulary. And if you're not familiar with what a formulary is, but it's just basically a list of drugs that are included within a hospital system, a healthcare system, a physician's office. So it's just a list of those drugs and how they are to be managed and used within that particular space. So those are the individuals that I engage, and I'm primarily focused on those individuals who deal with oncology pathways. As I mentioned before, that was the role that I had within Anthem. So those are the individuals in that particular space that I engage. And those includes physicians, pharmacists, medical directors. So it's many of the individuals that are, oftentimes we hear the term C-suite, but those individuals that make those clinical determination of what drugs are added to their oncology pathways or their oncology formularies within their respective institutions. So that's kind of a high level synopsis of what my role entails. I hope I didn't miss anything, but I think that gives you kind of a very broad view of my previous experiences as well as kind of what I do now. And we can dig into that a little bit deeper if you have specific questions.
Thank you so much, Kimberly. This is Gina, everybody. Thanks again for joining on. Kimberly, could you kind of delve a little bit deeper into your education, like some of the classes that you took while you were at Spelman and before you went into pharmacy school? Can you tell us a little bit more about that?
Sure. So as I mentioned, I received my BS in biology. So I took the traditional science courses. I was actually pre-med when I went into college, thinking initially that I wanted to either be a gynecologist or an anesthesiologist. But luckily enough, I was afforded the opportunity to do a dual degree program within my institution and the local medical school, which was Morehouse School of Medicine. And during that summer internship, I realized that medical school was not for me. So that was a great opportunity. So I didn't waste my parents' time or money. But I took the traditional courses. Like I said, as being a biology major, you were required to do your organic chemistries, several different life science courses, general chemistry, calculus, of course, your standard college courses like your Englishes, your foreign language courses. But of course, because it was a scientific degree, it was heavily focused on your life sciences. I actually also had to take botany. But then my junior year, when I realized that I wanted to do something within the healthcare space, but not medical school, but I wanted something that was closely aligned, that's when I started looking into pharmacy school. And pharmacy school required a lot of the same courses as medical school, but there were some nuances where I had to actually take some economics courses because that was required. I also had to do a public speaking course and statistics. So those were some additional courses that were not within my curriculum within biology, but I had to take those additional courses to, as a prerequisite for acceptance into pharmacy school.
Cynthia has a question. You can go ahead, Cynthia.
Thank you, Claudie. Good evening, Dr. Ford. I wanted to know if there was a defining moment where you kind of got clarity that you didn't want to go to med school and wanted to pursue pharmacy instead. Was there like a moment that made you think this is not for me, and what was it?
Okay, well, good question. And yes, it was, because during that summer internship that I did with the medical school, I actually had to shadow a physician. And I went on rounds with him and visited his practice and actually saw patients. And it was during that time that I guess in my mind, I had tunnel vision and what I envisioned a physician doing. And he was a general practitioner, so I got to see a little bit of everything. But I think I remember one of the first patients he saw was a kid, and he was a special needs kid, and he had a lot of different issues. And what I saw, I just never imagined that would be the type of patient that I would have to see. And then he had a patient that was in the nursing home that had cancer. And that was, for lack of describing what I saw, but it was very depressing. And it was just several visits like that just kind of, it wasn't that I didn't like the sight of blood, because I didn't like it, but it was just something else that it did to my psyche that I just didn't like the way it felt. And I know sometimes they say, well, if you see it enough, you'll get used to it. I just felt like for me, it just didn't, the energy and the vibe and feeling that I got from those experiences, it just didn't feel comfortable. And I just didn't feel like that was what I wanted to do long term. And just having those discussions with him, as well as at the time with my own personal physician, it just afforded me the opportunity to really see it up close and personal, and know that a lot of what I saw, I know long term that is not what I wanted to do. And even within the pharmacy space, because in pharmacy school, I had to do rotations, and some of those rotations were clinical, where we actually rounded with the medical residents. And even, like I said, even in the pharmacy space, I knew that I didn't want to go that clinical, because I have colleagues who are on the clinical side, and they go to codes with the physicians, and they round with the doctors. And for me, that close, I want it to be connected to the patient, but not at that intimate of a level. So that was kind of that experience within that summer with Morehouse School of Medicine, and having that experience and shadowing those physicians and seeing those patients up front and what they had to deal with, let me know that wasn't the route for me.
Thank you so much for sharing that with us.
Oh, you're welcome.
Yes, Dr. Eccles?
So I'm muting. It was, thank you so much for joining us, Dr. Ford. Very impressive career, and we're looking forward to learning more from you. If you can, on that note, just to follow that, you're still providing care, patient care, but it's in a different format. Can you please expand on that? How you are helping patient care?
Well, in this current role now, even though I'm not directly related to the patient, the work that we do here within GSK, the information and knowledge around our assets, and when I say asset, I mean our products that we have marketed, as well as the pipeline, providing those physicians and pharmacists and other clinical personnel with the information around and the knowledge of the appropriate use of our medications. That information being shared with them is ultimately provided at the point of care to the patient. So even though I'm not directly face-to-face with that patient, but providing those physicians and intimate caregivers with the knowledge around our assets and the appropriate uses, that ultimately helps the patient.
Thank you.
I also had a question. So like, obviously, if you went down the medical route, you would become a doctor, whatever. It's very, once you get the job, like, it's very time consuming and not as flexible. How flexible, or like how much like free time or flexibility do you find like in your position with a pharmaceutical company, as opposed to when you're kind of like working in the hospital setting?
Well, being that I work from home, so being remote and being field-based means that I work from home. So my work day is very flexible, because oftentimes the meetings that I have, especially if they're engagement with the accounts that I have, you know, it's not a strict 9 to 5 job. So there are days where my calendar is heavily booked, but then there are other days where my calendar is very open. So there's a lot of flexibility. That's one of the wonderful things about the role that I have now, is so much flexibility. if I have doctor's appointment, if my kids have something they need to do, there's a lot of flexibility with that. So, and I didn't have that working within the retail sector, because I was at the time, you know, when you're a pharmacist, and you're working in a drugstore, you're the only one there. So if you leave, by law, the pharmacy has to shut down. So there is no, I have a doctor's appointment. If I have a doctor's appointment, I have to take off or get another pharmacist to cover my shift. So that is one of the great things about the role that I have now is there's a lot of flexibility. And I think Gina can attest to that as well.
Absolutely, absolutely. Kimberly, can you maybe just share with the ambassadors and the other MiOra interns just a little bit about what it was like for you being not only a woman, but a Black woman in a pharmacy school, which is not your typical career that we think of when we think of women. So could you just kind of, explore that a little bit more and just kind of talk about those decisions that you made and what kind of experiences you had being a woman, being Black, and kind of managing your way through your career?
Well, that's an interesting question. I will say that, and I mentioned earlier that I graduated from Spelman College undergrad, which, if you're not familiar, is a historically Black college. So coming from that space and moving to Mercer, which is a predominantly white institution, it was very different because Spelman was very nurturing. And it not only is an HBCU, it's an all-girls school. So it was definitely different at Mercer. I will say I did not have any negative experiences. It gave me a different vantage and viewpoint on the professional side from what I had as an undergrad. My class was very diverse. And I don't know if you're aware, but in the profession of pharmacy, it's a pretty predominantly woman-based profession. So there were a lot of women in my class. As far as minorities, not so much, especially African Americans. I believe it may have been maybe about out of a class of about 120 or 30, if memory serves me, there may have been 20 of us. But there were definitely other people of color within my class. And like I said, I didn't have any negative experience, but I just think navigating that space as a woman, as a person of color, I think you go into it with the mindset that you always have to do more to prove yourself. And it's not that anyone specifically did anything, but there were, I guess, moments being, especially being a woman, that I felt in some of those male-dominated spaces that I had to do extra to prove myself, if that makes sense. And like I said, it's not because anyone did anything specific, but it just kind of, I went into it with that feeling because even though the class was predominantly female, the professors were predominantly male. But as I said, I didn't have any negative experiences. I think it's just me walking into that and feeling like I had to prove myself, and being a woman of color, having to do more to ensure that I was seen as just as capable and able, if that makes sense.
Thank you for that, Kimberly. I know sometimes it is difficult for us as women or minorities getting into a position or finding something that is, you're passionate about or what you realize you want to do. So it's really important, I feel, that you take the time and be able to discuss with people your thoughts, your interests, because that will definitely help you along the way to understand the different routes, the different things you can do, like being able to sit here with Kimberly and understand, you know, her path and being able to ask her questions. This is going to be so beneficial to everyone. So again, I thank you, Kimberly, for doing this for us.
Oh, you're welcome.
Any other questions?
Victoria, you have a question?
Yes, hey, Dr. Ford. My question is, I guess when you went into your like graduate for pharmacy, was there like a point or a moment when you're like overwhelmed and you had to like juggle school and life? Because like for me currently, I just started graduate school and I had moments of, I've been having moments of overwhelmness and trying to just catch up with things, and it just seems like everything is coming at me real fast. But like, how did you handle that? And I don't know, maybe some advice.
Well, yeah, I think all of us have, and you know, every one of us, you know, our life at home is a little bit different. So I don't know if, you know, if you work full time, if you have a family, like all of those different factors play a role. For me at the time, because I went straight from undergrad into pharmacy school, so I didn't have a full-time job. I didn't have kids and I didn't have a family. I wasn't married or anything, but there were definitely classmates of mine who had all of the above. But there were moments, even though it was just me, because I did work part-time and I did do volunteer work. There were times, especially with some of the harder courses, you know, just adjusting and feeling overwhelmed. I think that's just normal. But for me, one of the things that I learned that I had to do was to take time just to step away from what was going on and just give myself some me time. And I think, and even now, because sometimes depending on what I have going on, it gets to be a lot because it's just busy. So one of my ways of managing that, even if it's just an hour or so of just walking away, grabbing some coffee, reading a book. And I know you're saying reading a book if I'm already in school, another book, but just something different, whatever it is that you find relaxing, just taking that time just to kind of unwind and get your mind settled to something else for a minute. That was one way for me. And even if it was some of my girlfriends within school, we would get together and go to lunch because we were all going through the same thing. And for me, talking to other people who are going through what I'm going through, they not only understand it, but they can kind of give you some ideas on, you know, how they deal with it. So for me, that was some of the things that I did to kind of manage the stress and manage the overload, because I mean, it happens, it does.
Thank you for that. Thank you.
You're welcome.
I also had another question. So I'm kind of in the same situation that you were before. So I took pre-med. So I just graduated the medical sciences program. So it's
congratulations.
Thank you. So it's basically like a pre-med program, and basically I want to get into medical school, and I liked it. I did the shadowing and all that, and like I liked the patient experience and all that. But my issue is kind of like getting into medical school, which kind of has become the hardest part nowadays. And I've kind of like been looking at other options, and the pharmaceutical industry like has really caught my eye as well. Do you have any advice or like different positions or anything like that that you might have to give?
So when you say you've been looking, two things. So the first one, when you say you've been looking at opportunities within pharmaceutical, do you mean pharmacy school or just going directly into the pharmaceutical industry?
The more so the pharmaceutical industry. So like kind of honestly multiple positions, like even like pharmacists I've kind of considered, but I was kind of like I would prefer to work for a pharmaceutical company. So I was looking at stuff like starting off as like a sales rep, or like the what's it called, like in clinical trials, or like the drug manufacturer developers, or like the people who are behind kind of like the science of like developing a drug, like those kind of positions, if you know much about those. Yeah.
Okay, so the first thing when you mentioned, medical school, you were interested in medical school. My first thought was, have you thought about doctor of osteopathic school? Which is,
Yeah, I yeah,
an
I'd
opportunity
considered
as
it,
well.
but I I wasn't fully convinced on it.
I got
I
you.
feel I like the pharmaceutical route more. So
Okay. Because I know MD, DO, they're very similar. It's just I think one is more Western medicine based versus the other one.
yeah, exactly.
As far as opportunities within the pharmaceutical industry, I have colleagues who actually have started as a sales rep and moved into other positions within the pharmaceutical industries once they got the opportunity to kind of get their feet wet and see what other opportunities are in that space. So I definitely think that if you think that that may be something of interest, I would definitely explore it and try to speak to people who have that role. A question that I have for you is with you being interested in patient care, especially with you saying that you have an interest in medical school, because being a sales rep is more commercial based and it's not as
You don't really get that
clinically
patient interaction, right?
well, no, because you would just be dealing
Yeah,
mostly with the
more
physicians
so on
and the
the
people within the front office. My
exactly.
question would be, if you took that route, would you still be interested in getting another degree outside of what you have now that would put you in a position where you could get a more
Oh yeah, for
clinical
sure.
role? Okay. Yeah.
Yeah, and then one
Yeah.
of my friends even told me, so they had recently kind of started something like that, and they basically said that they kind of got like an offer from a pharmaceutical company, and they even like there's like potential that they, if you needed more of that schooling, that like they kind of help you out financially as well, kind of thing. That
Yeah.
makes sense.
Yep. It does. And, and,
With
and that's
the
true.
schooling, yeah.
Yep. Yeah, I definitely think that's definitely an alternate route if that's something that you're interested in. I would advise to definitely try to speak to someone who's done it, or at least someone who's in the role to give you more insight into it. But I definitely think that's a route that you could take. And there's a lot of opportunities within industry. And it's not just you have to be sales or you have to be this, but there's, as you mentioned, with clinical trials, that's a very interesting space as well. So there's a lot of opportunity and variation and opportunity within the space.
Thank you very much.
You're
Does anyone
welcome.
have any other questions? We have until 8:40. Dr. Eccles, you have anything to add?
Can you comment on an area where you had challenges, you had difficulties, and how you overcame those? Because sometimes young people, when they look at someone successful, they think that everything was smooth in the career path of that person. Can you comment on some of the challenges you had and how you overcame those?
Oh, absolutely. So, I mean, within every space that I've been in professionally, there's been some challenges. Even, back in retail, and I don't know if many of you have ever worked with, in a customer service oriented position, but being a pharmacist within a drugstore, you're dealing with customers all day long. So you deal with customers who are irate because their insurance doesn't pay for their medication, or they forgot their refill, or you call the physician to let them know that the dosage they wrote is incorrect. So you deal with all of those things. So for me, in dealing with that, I always, one of my mantras of life, especially my work life, is to, and I know it may sound cliche, but to deal with people and treat people the way that I want to be treated. And it usually works out for me. And I know that if I return the same energy that I'm getting, the result and the outcome is not going to be positive. So leading life and working like that has afforded me the opportunity to kind of manage those stressful situations. So that was in like the retail setting. As I mentioned, I did PRN work in the hospital space, and I did 9 years with a long-term acute care facility, which these are the sickest of the sickest patients. They've outstayed their welcome within the hospital, but they're too sick to go home. So they have to go to a long-term acute care facility. And in that role, I actually had on-call hours every other weekend. So I would get calls from physicians and nurses, and they want me to dose something. And I remember a doctor wanting a dosage that was not per the hospital protocol. And I got the, well, you're not the doctor response. And it was just bad. But I held, to my guns, and I knew what was protocol and what I had to do. And it wasn't an issue of one is better than the other one. When I was just doing what I had to do and what was correct and appropriate for the patient. It was stressful, and it's hard because I had to go into work the next day and face him, face to face. So with those, I just, I realized that it comes with the territory. I don't stress out about it. I know what I'm supposed to do, and as long as I stick to what I know is appropriate and per policy and protocol, it may be aggravating at the time, but I do what I have to do and what I'm supposed to do. And I let leadership and the people above me deal with those issues that are above me. Even within in managed care, and I know I mentioned that I did prior authorization review, where in that space, if a medication was sent to me and I couldn't approve it and it was denied, well, then I had to do what was considered a peer-to-peer with the doctor to explain to him why I didn't approve his medication. Well, as you can imagine, that didn't always go well. So again, with that, I knew what the policy was for the organization I was working for, what I could do and what I could not do. And I would explain to them, even though I can't approve this, this is what I can do. And oftentimes people appreciate that. I think being honest and letting them know what I can do and making myself relate to what they're going through, not that I'm just trying to strictly deny something or be this mean person, but you do have recourse if this doesn't work. And oftentimes, more often than not, that actually appeased the person that I was talking to let them know that, I understand where you're coming from. And I think if you listen and you respond and let them know that you're listening and you understand whatever the issue is, whatever the situation is, I think that goes a long way. So I think my advice for dealing with those challenging and stressful situations is, like I said, just thinking of putting myself in that other person's shoes. And even in doing that, it doesn't always go the best way, but the majority of the time it does. And then in listening, because a lot of those roles that I've been in, especially in retail, they're customer service type roles. And I think if you lead with listening and empathy and those, because you're dealing with sick people, or you're dealing with people who are trying to help their patients. They're already upset. So if you lead with compassion and listening and then letting people know that you hear them and you're willing to try to make the situation right, I think that goes a long way. So that's kind of the way that I kind of lead through those stressful situations.
Thank you. And those are really stressful situations.
Yes.
And kind of just before we start to wrap things up, we have one last question from Finesse. Just before we get to that, if anyone has any other questions that kind of come up after, can they email you or email me?
Absolutely.
And I can kind of redirect those questions to you and give feedback to them, or
absolutely.
Which would you prefer?
They can email me directly. And even after this, if it's 3 months down the road and you think of something and you have a question or an interest, don't hesitate to reach out. I don't mind at all.
Okay, thank you very much. And last question from Finesse before we end things off.
Okay.
Yes, good evening. Can you guys hear me?
Yes.
Yep.
Okay. Thank you so much, Dr. Ford. I really appreciate all the information you have given us today. I had a couple of questions mixed into one, so please spare me some time. So you did say you had your bachelor's in biology. I did also, but throughout my whole bachelor's in biology, I did everything for like medicine, the medical school route, but then my MCAT ended up failing on me. So then I started a master's program. I was wondering, did you ever take like a gap year or start a master's, or like what was your thought process after you had your bachelor's? Did you already, after those rotate or after those shadowing experience, did you already know you wanted to enter in pharm school? So then you took the PCAT, or how did you navigate through okay, I'm done with school and now what's my next step? Or did you take like a breather and a step back and, just look at more stuff?
I did not take a gap year or a step back because I knew that for me, I just needed to go straight through. I didn't want to have that break from not going to school because I just felt like if I paused, that it would be that much harder to get back in the groove of being a full-time student. So I did it straight through. And that the experience that I had with the medical school, that was my junior year. So after I realized I didn't think that wasn't the route I wanted to take because my parents had already gotten me the Kaplan books to study for the MCAT and all that good stuff. But after I realized I didn't want to go to med school, that's when I started looking into pharmacy school. And I actually visited the school and talked to other pharmacists and students and things like that. So it was right on time for me because I was still able to take those prerequisite courses that I didn't have prior to being accepted. So I was able to go straight through. So I did undergrad 4 years and then 4 years of pharmacy school.
Okay, thank you. So I'm actually in a master's program, master's in public health. Do you think it's good for those, for people to have
Absolutely.
like a master's? Oh,
I do.
Okay.
I do. I actually had several friends when I got into pharmacy school that did the Masters of Public Health before going into pharmacy school.
Okay. Thank you so much. I really appreciate it.
You're welcome.
Thank you again.
Yeah, there are so many different routes to get to where you eventually want to be.
Yep.
I mean, there's no straightforward way for each person. Kimberly and I, we went straight from high school right into where we wanted to go, but that's not necessarily everybody's path. And as Kimberly said, I just want you guys to persevere, even though you are in a holding pattern or you're waiting to get into medical school, nursing school, pharmacy school. Don't let that deter you from continuing what you want to do. You may have to take a year off and maybe work and get some experience or do something different, but that doesn't negate you being able to still do what you want. So as Kimberly said, keep reaching out. Kimberly is always available. I'm available. And you start making these connections and contacts, and those will help you.
Yep.
Because sometimes it's not necessarily what you know, but who you know and how you can utilize what they have to give you. So it's so important to just stay the course and continue to persevere because everybody has potential and there's something that's going to be great for each person. It just may take you a different path to get there. It may take you a little bit longer to get there, but there's nothing wrong with any of that. So just keep putting that one foot in front of the other is so important.
It is.
All right. And Dr. Eccles, is that a hand from your previous question, or do you have another one to add?
I have another one. So if you look back and at least we can make this the last one. Thank you so much I know you're 3 hours ahead. But if you could look back, what kind of advice would you give to your, younger self? Don't worry about this or do that. And what would you develop yourself in this area? What advice would you give to your younger self?
I think one bit of advice, a couple bits of advice that I would give my younger self is one is to live and take in everything of the moment. Take advantage of the resources that you have. Like I was so super focused in school and schoolwork that I think a lot of experiences that I could have had, such as traveling abroad, deepening some relationships and friendships and making connections. And don't get me wrong, I have great friendships and lifelong memories and relationships. But if I would have stepped outside of my tunnel vision of just studying and ensuring I had the grades, but getting the full experience of that time in college, that's one thing I would have done. I also would advise, give yourself grace. And even now I have to tell myself that because we often beat ourselves up so much if we don't attain perfection. And a lot of time people within these medical spaces and scientific spaces, we're perfectionists and we don't give ourselves grace. And we've really accomplished a lot. And even you all have accomplished a lot. And I just say, give yourself grace, and it's okay to make mistakes as long as you pick up and keep going. But I think those are two pieces of advice that I would give my younger self, is to just really live in the moment and take advantage of those resources and opportunities, and giving myself grace, and knowing that it's okay to not be perfect at everything. Because that adds stress to your life, unnecessary stress.
Thank you. That's very helpful. Also, it helps one focus.
Yep.
Yeah, so thank you very much, Dr. Ford. Yeah, we basically just had the 45 minutes scheduled. So if anyone else has any other questions for Dr. Ford, just shoot me an email or shoot her an email. I'll make sure all of you guys have access to her email. So that way you can ask whatever remaining questions or questions that come up after. I'd just like to say thank you again for taking the time, coming out, talking to us, giving us that wonderful advice. And thank you, Gina, for setting that up for us here at MiOra, and Dr. Eccles as well. And yeah, just thank you very much. I learned a lot. So I know I personally will take a lot of that advice you gave. So thank you.
Oh, awesome. And thank you so much again for having me. If you're on LinkedIn, please connect. And hopefully we'll keep in touch. But as I mentioned, if you have questions, whether it be the near term or long term, don't hesitate to reach out.
Thank you. Thank you, Dr.
Thank you
Ford.
so much, Kimberly.
You're welcome. Thanks, Gina. Take care.
Yeah, have a great night, everyone.
All right, take care, everybody.
Bye-bye.
Enjoy your week.
Thank you.